Welcome to the PatientX podcast, where we talk all things healthcare marketing, especially as it relates to patient experience. And today I'm so excited to welcome Sarah Henderson to discuss what I think is a really serious issue related to burnout in physicians, healthcare executives, and healthcare staff across the board. But we'll have a unique focus today on how taking strides to improve emotional intelligence can actually rekindle their energy for patients and ultimately improving the patient experience. So this is a really important topic and one that I wish everyone would discuss more. So I'm excited to talk about this today. Welcome to PatientX Pulse, where we're making the heartbeat of healthcare marketing stronger, one episode at a time. Join us on this journey as we pulse through the veins of healthcare marketing, delivering insights, strategies, and results that matter for patient experience.
Awesome. Thank you so much, Kimberly. It's a pleasure to be here.
Yes. So what would you say about this presentation today? What can people expect?
I would say you can expect some solutions to some of the problems or challenges that you may have been having, either with staff or patient reviews. As a healthcare marketer, just in marketing in general, we think that a lot of things happen because of the patient reviews or because of social media or because of the atmosphere within the office, but we oftentimes forget where the root of the problem lies, and that also often lies within the individual. So I'm excited to talk about that. With over 18 years of healthcare experience, being in pharmaceuticals, medical device sales, directly in the OR, involved with training and all the way up to global positions. I certainly have had my fair shares of experiences, with great physicians and nurses who have had amazing bedside manner, amazing emotional intelligence, as well as IQ. But there is a difference between emotional intelligence and intelligence, and to understand the distinctions between the two are key for any role, for that matter.
Yes, I am excited. So, Sarah, you've mentioned a little bit, but let me tell you a little bit more about Sarah. She's actually the creator of Rebound and Refocus, which I know she'll talk more about today. She is a very passionate advocate for healthcare, as you've heard, and she's been empowering physicians to enhance their emotional intelligence for years. So, this isn't something new for her. This is something that she's been doing for a very long time. And with over, I think, 15 years or more of experience in sales and training and even strategic global marketing, Sarah has developed and continues to deliver transformative workshops that foster these stronger patient provider relationships and improve overall well being. So, Sarah has a really diverse background. I'm excited about it. She's been in corporate leadership, but she most importantly has a really deep commitment to holistic well-being, and I think that's going to prove very valuable in our conversation today. So I know we're going to get a very unique perspective on professional growth and the customer journey, patient experience. So Sarah, thank you so very much for being here with us today. And I want to dive in though, before Sarah, you join in. I want to just kind of address something that I think, as if there's any marketing professionals who are watching this video right now, they might say, why would I be worried about physician emotional intelligence or EQ or burnout amongst the team? Like, how am me as a marketer, how does this connect to me? Well, Sarah, I know that you and I both know that healthcare marketers are often tasked with what I would say fixing problems like a low patient volume or staffing issues that are sometimes caused by problems that are completely outside of the marketing team's control. So they can bring in patients, they can bring in new recruits through advertising and marketing, but for example, you've touched on a couple of them, Sarah, already. If a patient comes into contact with a facility, maybe through their online presence, maybe by calling in on the phone, maybe they even walk in the doors, they see a physician, but at the end of this visit, they indicate a low satisfaction score, maybe referencing things like confusing information or a bad experience when they're online, rude or unfriendly staff on the phone, or maybe at the front desk when they walk in, or possibly it's a nurse or a physician or a surgeon who leaves that patient feeling kind of unheard or misunderstood. So that's one example. Or what if a marketing team is asked to recruit new staff, but in addition to the burnout that already exists in healthcare, what if that business is struggling with things like poor communication inside their walls? Maybe a lot of the staff are feeling overworked, maybe underappreciated, harassment, bullying, lack of opportunity for them to grow. These are all things that are happening outside of a marketer's control. So, as you can see, healthcare marketers are often in a position to maybe perform by bringing in new patients or recruits, but these issues that are prohibitive or affecting things like patient satisfaction scores are low, maybe there's low morale within the team. They can't be fixed by marketing, but marketing plays a role. So, here at PatientX, I know, Sarah, you're really familiar with this. We believe in the pillars of healthcare marketing. These are the core areas of marketing that most impact the patient experience. Things like brand health, website health, online reputation, patient satisfaction, the referral network, but also on that list is cultural health. And this is a category that I think kind of encompasses what we're talking about today. And when we say cultural health, what a strong internal culture can mean um, could be like mutual respect, adherence to rules within the company, protocols and processes that are in place and being followed by the team, accountability, happy and secure staff from the top to the bottom. And then, of course, there's so much more than that. So, today, I think we're really focused on the physicians and the healthcare teams, but really how important their mental health and their ability to relate well to patients is ultimately going to improve the patient experience. So that is a lot. But whether you're a healthcare marketer, you're a physician, you're an executive in healthcare, all of this will be applicable to you today. So, Sarah, I just want to just turn it over to you. Talk about your research, your experience, and ultimately, kind of, what is the cost of failing to connect with patients? I think that at the end of the day is what a lot of things boil down to, right? So, you dive in. Tell me what you've seen, what you've learned.
Absolutely. Thank you so much, Kimberly. And you hit so many nails right on the head. As a marketer, you're being tasked with, bringing in more patients or bringing in more consumers. And there are certain things that are outside of your control. And, when it comes to healthcare, everyone is a healthcare consumer, regardless of your race, your gender, your demographic, your income. And so for me, as someone with the experience that I have, I start with the data and I evaluate your specific patient population. And when, we can talk about unconscious biases because they are so important, even just within, the current climate of the economy. With Target, they are experiencing a $12.4 billion decrease in their sales and their revenue because of what's happening. And as someone who is an indigenous woman, I can say that the current system of DEI does not work. It does need to be dismantled because I personally, although I've been in healthcare for over 18 years, I don't feel like I've ever benefited from it because of the unconscious biases that were there. And what I mean by that is just a narrow optic view of thinking. If, just being a woman, right? People think that women can't drive, and you have all of these societal unconscious biases that carry over into how you treat and how you think about people. However, businesses like Target are feeling it because the African American and Hispanic population, they are a $12 trillion consumer industry on their own. So not together combined, but they're a $1 trillion industry separate. So it's important to know that, if you have an unconscious bias or a very narrow optic view, that is only 4% of the global view of the actual view of the world. So it's getting people to think about a wider view, because if we think about a narrow view, especially in the evidence-based medicine world, right, a 4% isn't even statistically significant. So if you're expecting to make a big impact, you have to be able to see in the eyes of the consumer. And if you get it wrong, that can be extremely detrimental to the brand and reputation, and trust of the patient population is important. It's important for the healthcare business, but it's important for the overall health of the world. You have more sicker people in a given country than the overall rating or the health of the country itself is a poor country. So if the patient population is a large percentage of the area and the location that you are in, I highly suggest that you try to relate to that consumer in the eyes of that consumer, to connect with them, to gain their trust, and ultimately their business. And if you're not interested in that, then I suggest that you find an environment that appeases whatever consumer it is that you're trying to relate to. So, getting it right and absolutely takes emotional intelligence and awareness of your unconscious biases and how they impact treating patients, especially in healthcare, because it impacts patient outcomes and pain management. There's differences in diagnosis, variations in specialized care, preventive services, discrepancies in diagnostic testing, and treatment recommendations. And so that alone is a huge discrepancy. But if we add and compile it to 1/3 of the healthcare population, um, is not engaged. So you have physicians that are burned out. You have nurses that are burned out. Forbes did a study, and they in 2022, I believe, where 70% of CEOs are burned out. They're leaving. And these are people that are making 6-figure, 7-figure incomes. And so it has nothing to do with the money, but everything to do with the person. And even senior level leadership, 60% of them are leaving. So the overall workforce is tired. I remember when I was still in medical devices, I learned that burnout actually became a diagnostics code. So you can actually be diagnosed, a clinical diagnosis for having burnout. So it's a crisis, and it's not just impacting those that are on the front lines, it's destabilizing leadership. So what do you have now? You have people that, nurses that may be newly trained, newly graduated, where they're now having to treat high acuity patients because your senior nurses, the ones that know how to treat those high acuity patients, they've left. They no longer want to engage. So that is creating a storm within itself. And for healthcare specifically, when it comes to emotional biases or having those conversations, especially if you're a hospital that is in a closed system, being able to talk about a patient's social detriments of health is preventative care. And it is estimated within my research, I found that the United States loses $55 billion due to missed preventative opportunities. And if you talk about chronic conditions, 80% of chronic conditions could be prevented just by lifestyle behavioral modifications and having conversations about social detriments of health. Why can't you get to the hospital? Do you need local transportation? What is your access to food? And to be able to, as a physician or a clinician, when a patient comes in, to talk about what's going on at home, that requires us to put down our biases, to put down any preconceived notions that we may have about the person's gender, their color, their social economic status, and get to the heart of the person. And that takes emotional intelligence. And if you're a hospital that's in a closed system, you can actually bill for talking about social detriments of health. So if you're not able to do that, you're even missing out on an opportunity to be able to bill and to see revenue within your institution.
Wow. That you just unpacked so many things, Sarah. So, simply put, what would be, in your experience, the direct correlation between burnout and actually taking steps to improve emotional intelligence? Have you seen a direct correlation where that actually improves satisfaction with their job? Or have you seen that in your experience?
Absolutely. Well, first, I guess I should define what emotional intelligence is, right? So we all know that intelligence, IQ, is an intelligence quotient. So it's a total score derived from standardized tests designed to assess human intelligence. So if you are a clinician, you are highly intelligent. You passed all of your exams and you made it, right? Well, emotional intelligence, where are the standardized tests for EQ? And EQ is your own internal awareness of what is going on with your emotions. So that takes emotional awareness. That's an introspective analysis. It's also emotional management, your ability to manage your emotions. If you have something going on at home, there were situations when I was a rep, selling wound care. So I would come across, patients that were in the trauma. We had an open abdomen device, and a lot of wound care is typically when the surgery goes. Oftentimes, when the surgery goes wrong, when there's a dehiscence and infection or hematoma and seroma, something is going wrong. So I'm already stepping into an environment where the physician may be a little bit guarded because it's a reflection of their work, right? Even if the patient was non-compliant, they didn't listen, they were still picking up their kids when they shouldn't have, or
Yeah.
they had poor hygiene. Whatever the case was, it's a reflection on the physician when that patient is readmitted because it's an unplanned readmission. So that physician is already going through things internally. And you also have to have a social emotional awareness of how it's impacting the patient. So you have to be aware of your emotions, others' emotions, as well as your relationship with yourself and them. So that is how emotional or EQ, emotional intelligence, is defined. And being able to do that, it takes a level of being able to understand. If you have the knowledge, that's one thing, but being able to apply it is different, because you can have the association with something, but you don't have the assimilation of it. And that's important in your actual practice. This is why their internships and externships are taken, because it's a simulation of a real world example. So that is one of the distinctions of being able to just hear and learn information, but actually practicing it and putting it into play. When I was in medical device sales and training in the training department, I took the reps that were hired onto the company to the cadaver lab, so they could get a real experience after they learned everything in their books, to see what everything they learned within those 4 weeks in that simulated environment. So it's important to be in a space where you can practice, where it's safe, it's safe, it's trusted, and you're with someone who has real world experience that is able to take a look at what's going on, but then also share some of the stories that I have, within the industry as well. So I think that there are several factors. I hope I answered your question. If not,
Yeah, I mean, when at the end of the day, if you are more self-aware, you are aware of others and aware of factors or just the fact that other people got stuff going on too, and that they're not the same as you and you're not the same as them. Just the simple self awareness, improving that can cause, hopefully, inspire a little more happiness and joy in the interactions that you have with your patients, your team, with everyone in a given day. Because I can see, there is so much burnout. Um, there's so much, and there's such a need for more healthcare workers. So not only do you have the burnout of the cultural stuff and how difficult that can be, but then you just have not enough people at the end of the day. There's just not enough people to do the jobs that need to be done. And so you have those few that are really diving in and doing more and more and can just get exhausted. So I can see that where the direct correlation comes into play, where just simply being more self-aware and practicing that self-awareness can actually improve your experience on a day-to-day basis. And obviously, if you're more self-aware, you're more understanding, you're probably going to listen better, you'll probably be a better person, which makes it more enjoyable for other people to be around you. If you're a physician who, you're just doing the job, you got the knowledge, you're in and out, taking that time, taking a second to see them as a person, to ask questions in a way that maybe they understand. You've talked about some different cultural biases where maybe there's miscommunications that the patient and the doctor aren't even aware of, just simply because they come from two very different worlds per se. So I can see the direct correlations. But I think you touched on this a little bit, but I want to ask you to really focus in on what can cause these failures to connect. I mean, we know, like, we can see as marketers, especially, we see the end scores, like really poor online reviews, or we see poor patient satisfaction scores. Like, we can see the end result of an unhappy patient. Um, but what do you think specifically can cause these failures to connect?
well, I think like you said, within the communication. So say for example, a physician is, doing an assessment on a patient and they're asking about their diet and what they eat, and this is an example that actually happened where the patient said that they were eating cracklinks. And as someone who's from the West Coast, I have no idea what a crackling is. And I guess the physician didn't either because they noted that the patient was eating crackers. Well, I learned that a crackling is like a fat piece of bacon, and it has as high in cholesterol and high in all these things, and it was actually poor for their diet. So it's something as simple as language, understanding what that means to the patient, or being able to be open and aware enough to ask a clarifying question so that you could properly get the right information so that you can appropriately assess and diagnose a patient. And that's one of the ways. Another way that you can identify if there are any challenges, if you are seeing that patients are complaining, if you check the patient surveys and if there's not a form that allows it, then you can certainly, use a blank space on the form and say, is there anything that you want to share, or helping create a question? I'm certainly here to do that. So if people feel like they're uncomfortable, if you notice that patients are asking to switch physicians, around certain people, then that will be a cute indicator. So a lack of empathy, a lack of compassion, complaints about how they're not listening to the patient's concerns. To really be able to analyze the data, conduct a anonymous survey internally within your staff, and to be able to take actionable insight, and do some retrospective chart reviews to see and analyze the data if you have any patient populations with any potential disparities. These are all the things that can be done upon working with clients that take the workshop, to be able to truly create a customized program and solution to resolve their needs. Because if there's frequent miscommunication or errors within charting, or a lack of collaborative problem solving amongst the staff, that's a sign of a culture that is definitely in need of some care, some therapy. So this is a good indicator of a lack of emotional intelligence within the staff, by noticing all of those things.
Wow. The one thing that just keeps repeating in my mind, and it's such a simple thing, yet so difficult for all of us to do. I don't care who you are, I don't care how high your IQ is, or even your EQ, like asking a clarifying question. It's such a simple thing, yet we probably, none of us do it enough. We just think we hear, we think we know, we think we understand, when we don't. And that example that you gave, I think, is such a perfect example. And I'm sure that it happens so much more than what we're even aware. So thank you for that. So you kind of touched on it. Like, if you think your team needs to improve in this area, like, what do you do? Who do you go to? Who do you talk to? How does someone, perhaps a marketer who is tasked with improving recruitment to get new team members in, or improving the new patient numbers that are coming in for a certain service line, but yet through their research and analysis, they identify some potential concerns and issues that maybe aren't being talked about? Like, what do they do? What's the next step?
I would say I would go and have a conversation. Who is the head of DEI within your hospital system? The physician that I work with, he's the head of DEI, in his department over at Kaiser. So, I would talk to infection control. I would talk to your director of nursing to see how, what challenges they're having. How does the staff handle conflict? Your administrators, HR, are people able to have these difficult conversation, and is there any actual resolve? If some people are saying, well, oh, we already have that training, it's online, my staff has already been trained. Well, how was it? Did it actually improve? Are you noticing any results? Are you tracking the KPIs? Was the training didactic? Was it more of a motivational, inspirational workshop? And then after that, everyone leaves. And then, was there actual role play practice and implementation? Were they uncomfortable? Did it get a little uncomfortable in there? And that's necessary, because change is necessary to grow, right? I like to use the analogy of a butterfly, right? When they're in their cocoon in the chrysalis, they completely are uncomfortable, and they fear that. Even a seed has to break out of its shell in order for it to grow into the earth. So I think that being able to allow yourself to just inquire, ask the question, begin to ask questions. And once you ask, you'll definitely see, people will be willing to share with you their truth.
Wow. And hopefully you'll find the right person within the company who will listen, who will again, ask clarifying questions and be interested in learning more about what you're seeing and what some potential issues could be. Because, I mean, marketers, advertisers, like all day long, we can we can do the job, right? But we want to ensure when a patient does come to our online presence or our physical location that they are getting the very best experience, and the people are such an important part of that. So it's worth taking the next steps to talk to someone, to ask more questions, to dive in deeper. And I think when you referenced, your contact, someone that you work with very closely over at Kaiser, right? You find the people that see it and understand it, who are willing to fight, to ensure that change takes place. Because within an organization, especially I think in healthcare, I mean, you've been in it, you've been on the ground. There's a lot of red tape. There's a lot of procedural expectations that can really bog you down, right? No matter what your position is, but especially if you're working with patients, there's a lot of boxes you need to check to do the job correctly. And I think that that could be sometimes where some of that burnout comes from, because there's so much focus on doing it correctly, making sure all the boxes are checked, making sure that you hit your quota of patients for the day. And that can make it difficult to stop during those interactions with the actual patient and actually talk to them like a human being and ask questions instead of just boom, boom, oh, yep, this is exactly what I think it is, prescribe, and then walk out the door and go see the next patient. And I think that find your cheerleaders, find the people who believe in it, who are willing to really stand up and speak out for the change that maybe needs to happen within the culture, and work together. Because I think, I would assume, I guess, Sarah, you've run into people within some of these really large systems that maybe they don't see the problem. Maybe they just have no interest, time, say there's no budget, whatever that excuse might be, right? How do you convince people who don't yet see the problem or don't yet understand the positive impact that this type of training for your team can have on your patients, and ultimately the bottom line, right? The revenue, the dollars. How do you convince them?
Well, what is the saying? Money talks. And it certainly affects their bottom line, and in healthcare, it really is a life or death situation, not only for treating the patients, because, patients coming into the ER, or they have these chronic conditions. And so getting it wrong literally is the difference between life and death. So the pressure of accuracy is compiled, and so that weighs on the person, and there's we can never forget that we are dealing and interacting with people, because we are all human beings. I remember the first time that I was in the OR in a surgery, waiting for one of the OR rooms, and um, a person had crashed, and so there were all these alarms and stuff going on, and I had been trained on all of the things, what the codes were. So I'm like on my phone looking at, like, what does that mean? What does a code blue mean? What is that? And a nurse was walking by, and I said, excuse me, what just happened? And she said, the patient expired. And like,
Oh,
I felt like I had like a clueless moment, right? Where I was like,
yeah.
expired, like there's no expir, like, is this a carton of milk? you know? So I think that, it's important. Even one of my best friends, who is a director of nursing, and, during COVID, in the midst of all of that, she said that nurses are actually trained to have a disassociation because of the amount of death, of the amount of things that they see. And as a human, if you associate it with the person, then it can play a toll on you. But putting up a blinder and just ignoring it, it only covers it up. You know, if someone, like, I have a poodle, and if she pooped it or peed in my room, I'm not just going to go in there and spray potpourri. You know, I'm going to clean it up. But I feel like we oftentimes mask and ignore what needs to be cleaned up, what needs to be addressed, and how to holistically handle and deal with it in ways that, we all know it's innately in us. We've been doing these things for thousands and thousands of years. But it's just getting back to being able to connect, getting back to the awareness, getting back to our breath, getting back to the examples, and just taking a moment and really thinking about the impact that you're having. Because a physician, especially, your oath when you first came was to do no harm. And doing harm doesn't just happen physically with misdiagnosing someone, it's an emotional harm. The nursery rhyme, sticks and stones may break my bones, but words will never hurt me. Words actually do hurt, and they have lasting detrimental effects to a person, and to how they perceive themselves, and ultimately how they heal. We all know that the placebo effect is real, and this is a mental and emotional thing where healing can happen within that space. So it's extremely important. It significantly impacts your bottom line by $55 billion alone, just by missed opportunity and having conversations about social detriments. And so, if you are looking at value based care, if you are looking at readmissions and all cause mortalities, all of these systems and ratings, and that have been put in place to rate hospitals on their performance. Well, now that there's this pressure on performing, you can't perform unless you have a solid team. If we look at sports, right, you got to have a solid point guard or quarterback, whatever sport it is.
Yeah.
You have to have a solid team in order to win the championship. And if your team isn't solid, then you're just not going to win.
So let's say a business takes necessary steps. What would be some tips that you would offer them, like practical tips to adopt this type of mentality as the cultural expectation, right? I mean, when we're talking about a strong culture, sometimes we have to start at the most basic things, but it takes time and it takes practice and it takes holding each other accountable, right? To what the standard is. I mean, you're familiar with Patient X, like we have a code of honor, right? This is our code. And one piece of that code is being willing to be called out on the code and to call out someone else on the code. And that is hard, 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 hard to do. But it's necessary. So I'm just curious, based off your experience, what types of tips might you offer someone um, in a business that has decided to adopt this mentality and hold it as a cultural standard within their company?
Well, I would say one of the simplest things that you can do, and it doesn't even take that much time, and that starts with being able to develop and foster a connection, to be able to develop and foster trust within communication. So, if you are having meetings, before you start the meetings and just get right into business, one of the things that I ask, people when I start to meet with them is, how is your head and how is your heart? Because my head might be focused on the meeting, but my heart might be upset because I yelled at my son that morning, right? And it doesn't have to be a long therapy session. It could just be letting you know, like, I'm feeling a little fuzzy today, like I'm not all there today. And that way, as a leader, and this is one of the things that I really admire about you. It's like you're honest. It's like, if I'm having a day and my brain is fried, can we come back to this conversation? Because it's wasting both of our time, right? Just as an example. And then it allows people to feel like they have the space to be human. They know that there's actually someone that cares about what they're experiencing and what they're going through. So it's just a simple question of, and we often say, well, I asked everyone how they're doing. Well, what is your automatic response? I'm good. I'm fine. That's normal. So, think about different ways to ask questions and engage your staff in your break rooms. Assign people, get a board and encourage people to write motivational quotes and, affirmations, and just implement little mindfulness techniques just throughout the day that will not be this huge change and shift, but you can make those small incremental baby steps will eventually lead to quantum leaps. And that is just, some some advice that you could start today.
I think you hit the nail on the head. Like, it has to be a habit. It has to be something that you're doing consistently and regularly and not skipping over just because it happens to be a busy or frantic day, because it's a busy and frantic day, I think, every day in healthcare for the most part. So consistency is key in everything you said. No matter what you decide to implement, no matter how you decide to implement it, being consistent, even when it's hard, is probably key as well. So,
Absolutely.
okay, so I want to give you the opportunity here to talk about continuing education opportunities because you are directly involved in this piece. So, let's say I, as employee, bring this idea forward. I see opportunity where we could improve our team, physician, administrative, emotional intelligence, and see that direct link and how it's going to impact our patients and ultimately our dollar signs, right? Um, there has to be a next step, right? We can't just wing it. We have to have a plan. And I know you've been a big part of this plan for many different companies. So talk about your continuing education opportunities and what this could look like for a business who says, yes, we're ready. We want to take active steps to improve.
Well, first I would say to reach out. And so you can find me on LinkedIn. My name is Sarah Henderson. You can also contact PatientX. And well, continuing education opportunity. Well, facility, your physicians and your nurses can actually receive CME credits for this workshop, being that I have the experience. I've designed this workshop in such a way that it addresses all of the necessary objectives that would be qualifying for a CME workshop. So, within the workshop, there's clear objectives as well as a solution. And so there's a stage A of the program, and also a stage B where it's a long-term activity, because the change doesn't happen overnight. So you have to be able to integrate those practices and see where the physicians and the nurses are demonstrating their commitment to the continuous learning and improving their communication skills around patient-centric care. So there's a stage B and a stage C to all of this, and the workshop is extremely fun and engaging. Myself as a neurodivergent person and who understands adult learning principles, I've been in so many different workshops and lectures and conferences and conventions, where it's like you're just falling asleep. It sounds like that Visine commercial. He's like dry eyes, So I made it fun, engaging, and interactive. So those are just some of the high level stages where I have a presentation, that I can share, with the administrators if someone wants to know what's the justification for taking the workshop, what are the objectives, what are the goals, and what are the specific KPIs and how they can be implemented. One of my trifecta triple threat advantages is that I was in healthcare. I helped implement systems. I helped create protocols and procedures, because I sold capital cell equipment. So we also rented it within the facility. So there were a lot of things that I had to do just as a rep to help the ecosystem of the hospital environment. So I'm certainly here to help and support, move it through value analysis, or whatever process that is, because I know that it is a process. But I'm here to help and guide everyone every step of the way.
Awesome. Now you mentioned your LinkedIn page. We'll make sure that we get your LinkedIn link both on the screen and in the information below. So check that out. We'll also have a direct email where you can email us and we can put you directly in touch with Sarah as well if you want more information about this. No obligation, just if you're curious, if you have questions, if you want to explore it, if you want to dive in a little bit deeper and see what's covered in the training, I would definitely recommend it. So um, we've covered a lot today, a lot. But Sarah, any final thoughts that you want to leave our listeners with today?
Um, I would say noticing a problem is not a bad thing. That is just letting us know that we haven't discovered a solution. And I am a very solutions oriented person. The reason why I created this workshop is because I've been in healthcare for over 18 years. I know that the system is broken. I know that there are challenges. I've seen and I've experienced them firsthand. But I also have seen great examples and great demonstrations of physicians and nurses that are the gold standard, that have amazing examples and practices, and they are completely unaware that people aren't doing it like them. They're like, all your patients don't love you, well, then why did you become a physician? But we often lose that and become jaded because of all the pressures that we have from society, from the insurance payers, from, you have to see, now you have to add more patients and treat them within less time. So I understand everything that you are all going through. And I want to say that although we are in a very interesting climate right now, it's like here in California, it was 80 degrees yesterday. Now it's like 65 and going to rain. I'm like, well, this is indicative of the world right now. You don't know if it's going to be hot one day or cold the next.
Yep.
But that is the beauty of creation. Oftentimes things look very chaotic before beauty can bloom. So I would just say, stay encouraged and optimistic, and know that there are solutions. And the only way to find them is to look for them and to explore what those possibilities could look like.
I love it. Thank you so much, Sarah. I hope, listeners, I hope you're encouraged. I hope you're a little more self-aware of, what is happening on a day-to-day basis around you. I hope you've gotten some tools, some tips, some things that you can actually start implementing today, but practical tips that you can use to improve your cultural health. So we are just so thankful for you, Sarah. Always enjoy talking to you. I'm very passionate about this. I really think so much comes back to our culture and how we value people. I mean, at the end of the day, everyone wants to know about the dollar signs. They want to know the numbers, the KPIs. Where are we? How are we doing? And it does all matter, but I think people matter more. And
Yes.
healthcare is built around people who are serving other people. And so I just think your message is very, very valuable. And hopefully, we can do another follow up here soon to talk even more about it. So, if you liked what you heard today, be sure to subscribe to our channel, like and share our video. I think this is a very valuable message that will impact a lot of people. So, again, if you want to learn more about Sarah's workshop or get in touch with her, we will have her information both on the screen and in the description below. But in the meantime, thank you for tuning in to the PatientX Pulse and make it a great day.